right, back inside now on the show with Dr. Darren Scott from Chronic Care of Utah, and we are talking about thyroid and the symptoms. I mean, some of this is a buzzword right now, right? Do I have low thyroid? Do I not? So many people thinking of their symptoms. What do we need to know about thyroid issues?
Yeah, there's a couple things. So first off, the symptoms are weight gain, fatigue, depression, anxiety. Your hair can fall out, it'll be thinning, mood swings. Those are the pretty classic symptoms of thyroid.
Age-related, or can those symptoms happen in your 20s, 30s, 40s, 50s?
Oh yeah, really any age.
Any age.
Even as a teenager, yeah.
What triggers a low thyroid problem if you haven't had it in the past?
Well, and that's really what brings up one of the first things you need to understand is you need to find out what the root cause of your thyroid symptoms are. There's a lot of different causes of thyroid symptoms. In fact, there's 6 basic causes of thyroid symptoms. But the most common is Hashimoto's, which is an autoimmune condition. That's about 80% of the time that's what it is. And yeah, there's a whole lot of triggers. Hormone shifts, that's why many times autoimmune conditions are women. Hormone shifts, menopause and stressful events, accidents can trigger an immune response, and all of a sudden you have all these thyroid symptoms. Pregnancy is another big one. I just never was the same after my first or second pregnancy.
But as women, do we keep putting that off? Do we keep blaming it on this, that, the other? I'm tired, and then you have these years of frustration that you don't know exactly what's wrong.
Yeah, absolutely. That's exactly what happens, because everyone thinks, oh, it'll go away. I just need to work out harder. I need to, maybe I'll take some supplements or something like that. And they kind of push it down the road until they finally realize that this isn't working. And there is a problem.
How do you know if it is low thyroid or maybe something else?
So, traditionally speaking, most people when they get their thyroid checked, most doctors will pull 1, maybe 2 markers for your thyroid. But the full panel is like 11 different markers. And the interesting thing is many people I see, when we see patients all over the country, is they get blood work and they're told they're normal and they're not. And here's why. Here's a classic example. So Hashimoto's, there's a blood marker. It's called the TPO antibody test. So here's what happens. The reference range, let's say on LabCorp, okay, it has to be over 34, right? Quest Labs, it's like 20. I think they've recently changed it. But here's the thing. Mayo Clinic, you can go to Mayo Clinic website. Anything over 9 is a problem.
Look at that variation.
Yeah, so you get a patient will go in, they're like 25, the lab says they're normal, everyone says they're normal, but if they went to Mayo Clinic, they'd say, no, this is Hashimoto's.
No.
Yeah, crazy. So it's not just about, you've got to know what labs to pull, how to interpret the labs, and then once you find out what's wrong, then you got to know what to do. You've got to have a solution for these people, and there is solutions.
So when you go in to get a checkup, like most of us just aren't being tested for this.
Yeah, in particular, Hashimoto's, absolutely.
No.
Mainly because the standard of care doesn't really make any difference whether you're Hashimoto's or not. They're just checking to see if there's so much damage to the thyroid that you need thyroid hormone, and some patients absolutely do need that. But a lot of the patients that you work with is they're already on the hormone, but they're still having thyroid symptoms. So the doctors are doing the appropriate thing, but yet this is where we come in and we help so the patient's symptoms can actually go away, because the symptoms should have gone away completely if it was just the thyroid.
What's so great about this is there is hope. If you are feeling any of these symptoms, or you know someone who is, what do you do next after it's diagnosed?
So what we do is we find out what's wrong, and then we do a particular 2-part program. There's some lifestyle change, there's many adaptogens and supplements we need to use based on the science of the blood work.
Look at all these testimonials on the screen in front of you right now from the website for Chronic Care, people who have changed their lives. If you aren't feeling well, you don't have to. Please go to their website. And also right now, consultations are just $49. They are normally $250 for the first 20 callers. The phone number is right there on your screen. You can also go to ccofutah.com. Dr. Scott, good to see you.
Awesome. Thank you.
All right, coming up next, Michelle is over there and she's doing some hair. If you need to know how to do a beachy wave, she's